right, so let's start with men's health and STD. All right, so sexual transmitted diseases. There are multiple different STDs, okay? We have gonorrhea, chlamydia, syphilis, HIV, herpes, hepatitis, multiple different STDs. So the question is how those bacteria or parasites, goes in the uterus. So it goes through the vaginal cavity with semen, okay? It goes inside the uterus, it travels inside the uterus, goes to the fallopian tube. Then when infection gets further and further, it comes out from the fallopian tube. So infection can leave the fallopian tube and spreads to the other parts in the abdominal cavity, okay? Sometimes it can go up to the liver as well. So there are multiple different STDs, and if STDs gets worse, person can have PID as well, pelvic inflammatory disease. So first, let's talk about chlamydia. What is chlamydia? So chlamydia is #1 STDs in teenagers. This is bacterial infection. Most of the time, person is asymptomatic. They don't have any symptoms. They don't even have any clue that they have chlamydia going on. So asymptomatic, basically. However, sometimes they have this yellowish discharge comes out, okay? Most of the time it's asymptomatic, but they have this yellowish color, mucousy discharge coming out. So how do we diagnose patient? Diagnosis is through the probe, gen probe. We take the sample, we send it in the lab, okay? So if that person is positive for chlamydia, what do? We treat them. This is bacterial infection, so we treat them. There are two different types of treatment, uncomplicated and complicated. Complicated, that means basically we are treating PID, okay? Uncomplicated. So uncomplicated chlamydia, how do we treat that? We give them azithromycin. Azithromycin 1 gram, or we give them doxycycline. Doxycycline 100 milligram for 7 days. We also treat sexual partners as well. So remember the choice of treatment for chlamydia. Azithromycin. How would you remember this? Azithromycin. Chlamydia has Y in it. Azithromycin has Y in it. And doxycycline has Y in it as well. Okay. So choice of treatment, either azithromycin or doxycycline. Also treat sexual partner as well. Complicated chlamydia, we treat like PID. We also check patient for reinfection in 3 months. So the question is, what if pregnant patient has chlamydia? How do we treat her? So in pregnancy, patient can have azithromycin as well. They can have amoxicillin as well. The thing that they don't have, they cannot have, that is doxycycline. Okay, so choice of treatment for a person who is not pregnant, they can have azithromycin or doxycycline. If they're pregnant, instead of doxycycline, we're gonna use amoxicillin. Okay, so choice of treatment, the first choice of treatment is same, pregnant or non-pregnant, azithromycin. Okay, for pregnant patient, we check them for cure in 4 weeks. So test patient for cure in 3 to 4 weeks. So what kind of complications from the chlamydia can happen? Person can have PID, they can have Reiter syndrome, they can have Fitzhugh-Curtis syndrome. So first of all, let's talk about Reiter syndrome. What is Reiter syndrome? So that is immune-mediated reaction, and it's because of the infection, okay? Immune-mediated reaction due to the infection. So what do? supportive treatment, NSAIDs. In Reiter syndrome, person can have signs and symptoms. Sometimes they have conjunctivitis, they have urethritis, they have migratory arthritis. It's basically inflammatory response, okay? So we treat them with NSAIDs. Next one is Fitzhugh-Curtis syndrome. That is one of the complications from chlamydia. So Fitzhugh-Curtis syndrome, what is happening? Person has abdominal pain, first of all. They have belly pain, they have tenderness all over. Specifically, they have right upper quadrant pain. So what is going on here in Fitzhugh-Curtis syndrome? This is transperitoneal spread of the pelvic inflammatory disease. Okay, it's going all over in the belly. It's in fact going towards the liver, and that's why they have perihepatitis. It's a transperitoneal spread of the PID. It goes all the way up to liver. So perihepatitis, they have tenderness, they have belly pain going on, especially they have right upper quadrant pain. That is Fitzhugh-Curtis syndrome. So how do we treat? We treat patient just like PID, pelvic inflammatory disease. So here we are talking about PID. So what is PID? Basically, that infection has gone everywhere in the abdominal cavity. Okay. So what kind of signs and symptoms patient can have? They can have cervical motion tenderness. When you are doing pelvic exam, you are touching to their cervix, they're gonna feel pain. That is cervical motion tenderness. Adnexal tenderness. When you're doing pelvic exam or you're pressing patient's belly, okay, from your other hand, they're gonna have pain as well. That's called adnexal tenderness. They also have vaginal discharge. They have fever. They have abdominal pain. That is PID. PID, it is happening because of the sexual transmitted disease. It's going in the abdominal cavity, okay? So that is PID. What is the choice of treatment? Choice of treatment for PID is Rocephin plus Doxy. Basically, this treatment is very important because here we are treating gonorrhea, okay? Gonorrhea treatment is Gonosephin, that is Rocephin. And we are also treating chlamydia as well. Choice of treatment for chlamydia is doxycycline. So PID treatment, very important. Treatment is Rocephin plus doxycycline, with or without flagell. Next one is Neisseria gonorrhea. So what is happening here? This is the infection because of the gram-negative diplococci. It's a bacterial infection. So what kind of signs and symptoms patient has? Patient has this greenish color vaginal discharge. Gonorrhea, green, okay, green colored vaginal discharge. It can affect male and female. Chlamydia, all those sexual transmitted disease affect male and female both. So this person has greenish color discharge. They have vaginal or penile discharge. They also have lower abdominal pain. They have sometimes cervicitis, urethritis, okay? If it's spread, okay, if they have systemic gonorrhea or disseminated gonococcal infection, they're gonna have pharyngitis, salpingitis, prostatitis, epididymitis, everything. If it's spread everywhere, all the other systems are infected as well. That's called disseminated gonococcal infection. So in general, Neisseria gonorrhea, they have green color discharge, is just located in the perineal area. That's about it. Okay, that is gonorrhea. So how do we diagnose patient? We get the swab, send it in the lab. Okay. Choice of treatment, if they are positive with gonorrhea, choice of treatment is Gonosephin. That means Rocephin. Rocephin is the choice of treatment, but for you to remember, you can say Gonosephin. That is Rocephin. Always remember, GC chlamydia goes together. GC, gonorrhea, chlamydia, always co-treat. When you are treating gonorrhea, co-treat chlamydia as well. Okay. So gonorrhea treatment, not only Rosafen, but you always have to add azithromycin. GC chlamydia, treat gonorrhea and chlamydia together. So Rosafen plus azithromycin. Now this one is systemic. That means disseminated gonococcal infection. It went everywhere. They have fever, they have pharyngitis, they have skin lesions, tenosynovitis, arthritis, musculoskeletal pain, greenish purulent discharge. There is systemic spread of the gonorrhea infection. Complication, they can have migratory arthritis, pharyngitis, all of these. So what is the choice of treatment? Same, okay, same choice of treatment. Now next one is syphilis. What is syphilis? Sexual transmitted disease. There are three main stages, stage 1, 2, and 3. In stage 1, they have this painless cankering. It's clear base, well demarcated, as you can see in this picture. It's a sore, it's painless, it's cankery, well demarcated, clear base. That is stage 1 of the syphilis. Syphilis is the infection because of the Treponema pallidum. Those are spirochetes. Okay, so Treponema pallidum infection, it divides into the 3 stages. Stage 1, they have painless cankery, that is stage 1. Stage 2, as you can see in this picture, they have maculopapular rash. It's very contagious. They also have condyloma lata. Condyloma lata and maculopapular rash. This is very contagious. And stage 3, it affects the internal organ as well. It affects their brain, affects their kidneys, liver, everything. Person has valvular heart disease at this stage. They have heart murmur, they have neurosyphilis, they have confusion, everything. That is stage 3. So how do we diagnose patient? Diagnosis is rapid plasma reagent test, that is RPR for syphilis, that is the screening test, or VDRL. VDRL or RPR, that is screening test. If screening test is positive, what do we do? Then we order FDA ABS antibody test, that is confirmatory test. So VDRL or RPR, that is screening test, and then we order confirmatory test, that is PAT-ABS. So once patient is positive with syphilis, what do we do? We treat them. If it's stage 1, stage 2, we give them penicillin G, intramuscular, just one-time dose, and that's it. Single dose for stage 1, stage 2. Stage 3, what do we do? Stage 3, they get 3 shots. That means for 3 weeks, once a week for 3 weeks. That is stage 3, 3 dosage. Okay. We also, at that point, if they are in the stage 3, we refer patient to infectious disease specialist as well. Then we talk about HIV. HIV, what kind of signs and symptoms patient has? They have weight loss. They have recurrent Candida infection, fungal infection. They also have hairy leukoplakia of the tongue. Those are the hard membrane on the tongue that is hard to displace. They have weight loss, fever, diarrhea, cough, shortness of breath, thrush, all of those signs and symptoms. So what do we do? How do we diagnose patient? We order ELISA test. ELISA, that is screening test, and then Western blot test, that is confirmatory test. So what if they have screening test positive, what do we do? Then we order Western blot test. What if Western blot is positive as well? What do we do? Remember, those are the same tests we use to diagnose patient for Lyme disease as well. So how does it, different from Lyme disease and HIV? What do we do to differentiate that, yes, this patient has HIV? So we order is called HIV PCR test, antibody test for HIV. That's called HIV PCR. And if that is positive, that means patient has HIV going on. Okay. So first test ELISA, second test Western blot test, and third test that is HIV PCR. So what is the choice of treatment? Choice of treatment is Zidovudine. Those are antiviral, Zidovudine. Zidovudine, pregnant patient can take, newborn can take as well. If mother has HIV and she delivered the baby, baby can start taking after like 6 hours later after the birth. Okay. So within that first 6 to 12 hours, baby can take this medication as well. Then we talk about AIDS. What is AIDS? AIDS is the severe form of HIV. That means it depends on their CD4 count. Okay. CD4 count, normal, that is 500 to 1500. That is normal. 500 to 1500, that is normal. CD4 count and viral. Okay. Viral or virus and CD4 count, they fight inside, as you can see in this picture. So okay, so when person has virus, okay, virus goes inside the blood, and they have the CD4 numbers, okay, CD4 count. Those are in full amount in the blood. When viral attacks those CD4 numbers or CD4 count, okay, virus eats up basically those CD4 numbers, and it goes down and down and down. And at the end, in the blood, person would have too many virus and less CD4 count. That means viral load is much more higher. Okay. So CD4 count normal is 500 to 1500. When somebody has CD4 count that is less than 200, that means person has AIDS going on. Okay. So in stage 1, CD4 count is higher than 500. That is perfect. That is good. Okay. They have virus that is less amount in the blood. They have no symptoms. Patient is feeling good. Stage 2, their CD4 count gets down a little bit, 350 to 500. Then they have some minor symptoms. Stage 3, their CD4 count goes down to 200 to 350. And they have some symptoms. That patient is going towards the opportunistic infection. Okay. And as soon as CD4 count goes down to less than 200, that means viral load is higher. Okay. Those fighter cells are going down, and now patient is entered into the AIDS stage. Okay. In this stage, patient is high risk for tons of opportunistic infection. Main opportunistic infection where they can die from it. That's called PCP, pneumocystic cardiac pneumonia. Okay, PCP, pneumocystic cardiac pneumonia, and because of that type of pneumonia in the AIDS patient, they ultimately die. So that's why PCP prevention is very important as well. So as soon as their CD4 count goes down to less than 100, we give them Bactrim on daily basis. If their CD4 count is less than 200, maybe like 194, okay, what do we do? If they don't have any pneumocystic cardiac pneumonia going on, we don't worry about it. But if they do have PCP, what is the choice of treatment? Bactrim. Okay, we treat PCP with Bactrim, that is pneumonia. As soon as they have less CD4 count, that is less than 100, we automatically give them prophylaxis Bactrim. Doesn't matter if they have PCP going on or no. Okay, if they have pneumonia or they don't have pneumonia, we still give them Bactrim. Next one is Condyloma Acuminata. So what is Condyloma Acuminata? This is one type of HPV infection. Okay, it's caused because of the HPV type 6 and 11. Condyloma acuminata, that is soft, fleshy, that is shiny colored or shiny pedunculated growth. That is Condyloma acuminata. This is cauliflower-like structure. It's all together, okay, packed, cauliflower-like lesion. Soft and pedunculated growth, that is Condyloma acuminata. This is happening because of the HPV virus, okay, strain that is 6 and 11. If person is infected with HPV virus, that is strain 16 and 18, that can cause patient to have cancer, cervical cancer, uterine cancer. That is because of HPV 16 and 18. It can cause malignancy. This type of strain, it doesn't cause malignancy. That is type 6 and type 11. For prevention of Condyloma acuminata, we give them Gardasil. Prevention for HPV infection, we give them Gardasil, that is vaccine. This vaccine is given around 11 to 12 years, okay, but as early as we can give, that is 9 years of age. So what is the choice of treatment? Choice of treatment is Aldara, Pedophilax, that is Condylox. So Condylox and Aldara, that is two main choice of treatment. This medication is not given to the pregnant patient. So if pregnant patient has Condyloma acuminata going on, okay, we're not gonna give them Condylox or Aldara because those are teratogenic medication. They cannot have it during the pregnancy. So what if pregnant patient has this condition going on, and how do we treat? For pregnant patient, we do cryotherapy, trichloroacetic acid, or surgical removal. We don't give them any medication because Aldara and Condylox, it works like a chemotherapy, okay? How does this work on the lesion? Those medications, when they apply, it's gonna shrink down the lesion. So for pregnant patient that is teratogenic, so we do cryotherapy, okay, freeze down the lesion. We pour acid on top of that, that's called trichloroacetic acid, or surgical removal. So those are non-medical management, okay. Next one is herpes simplex. So herpes simplex, what is going on here? There are two different types, HSV1, HSV2. This is part of the herpes family. HSV1, HSV2, HSV1, it's causing the infection to the non-genital area, that is oral mucosa and oral area. HSV2 can cause infection at the genital site, okay? So what kind of signs and symptoms they have? Site of the infection, they're gonna have burning, tingling, itching, pain, all those common signs and symptoms. So what is the choice of treatment? Acyclovir, famciclovir, choice of treatment. If they have first time episode, we give them for 10 days, acyclovir. Second time episode, we give them for 7 days. And third time episode, we give them for life, okay? Diagnosis is made via culture, basically, viral culture. We get the culture, send it in the lab. Also RPR and zinc smear. Next one is trichomoniasis. So what is trichomoniasis? Trichomoniasis is infection because of the parasites. Okay, this is parasites infection there is a clue where patient presents to you with strawberry cervix, okay, and they have frothy, mucousy, vaginal discharge. So that is your clue. If they have strawberry cervix and if they have frothy vaginal discharge, that is classic sign and symptoms with trichomoniasis. They also have irritation, soreness, tenderness, dysuria, dyspareunia, all of those common signs and symptoms. Main clue is strawberry cervix, and they have frothy vaginal discharge. Diagnosis is made via wet smear. Okay, wet smear, as this is protozoa flagella infection. On the wet smear, we can see flagella, basically. On the wet smear, they also have large amount of WBCs as well. So what is the choice of treatment? Choice of treatment is flagell, metronidazole, flagell. 2 gram orally, okay? 2 gram orally. Always treat the sexual partner as well and avoid sex until the treatment is completed. When person is taking flagell, we also have to advise patient they are not to take alcohol with flagell. Otherwise, they can have disulfiramide reaction. They cannot mix flagell and alcohol. They can't drink alcohol when person is taking flagell to prevent the reaction. Next one is Chancroid. So as you can see in this picture, they have this painful soft ulcer with necrotic base. This is caused because of the Haemophilus ducreyi gram-negative bacteria. This is bacterial infection. So we give them antibiotic to treat. Okay. So this is Chancroid. They have soft ulcer, which is painful. It's bacterial infection. So what do we do? Diagnosis, we get the culture and send it in the lab. Treatment, we give them azithromycin. So azithromycin, choice of treatment for chlamydia as well. This is Chancroid, same choice of treatment, azithromycin. If they are allergic to azithromycin, you can do ciprofloxacin plus rocephin. Next one is Lymphogranuloma Venereum. This is another bacterial infection caused because of the chlamydia. Okay, this is the infection because of the chlamydia. That's called Lymphogranuloma Venereum. Lymphogranuloma, that means their lymph nodes are swollen. Okay, this is another condition where their lymph node swelling, it doesn't hurt them. It's painless. Painless lymphadenopathy. In the groin area, the lymph nodes are swollen and it's painless. They have papules. They also have ulcers on the genital area. Okay, they have ulcers and they have lymph nodes are swelling up. That is Lymphogranuloma venereum caused because of the chlamydia. So what is the choice of treatment? Doxycycline. Choice of treatment for chlamydia? Doxycycline. And alternatives is erythromycin. So as you can see in this picture, we have ulcers, okay? Ulcers, there are some ulcers are painful, some ulcers are painless. So if person has Lymphogranuloma venereum and if they have ulcers, okay, those are painless. They have syphilis, those are painless. Chancroid, that is painful. Okay, genital herpes, painful. Now let's talk about men's health. So here we have BPH, benign prostatic hypertrophy. When somebody has prostate that is enlargement of the prostate gland, what kind of signs and symptoms they have? They have urgency, frequency, urinary urgency, frequency, they feel full, okay? They have nocturia, that's the classic. If they have nocturia along with urgency, frequency, and if this person is older, they probably have BPH going on, okay? So hesitancy, nocturia, urgency, frequency, all this. So how do we diagnose patient? We do rectal exam. So if their prostate is feeling, it's firm, it's smooth, it's rubbery, it's symmetrical. So far, so good. That is normal prostate. But what if they have enlarged prostate? That is BPH. So firm, smooth, rubbery, symmetrical, that is normal prostate. But now it's enlarging, that is BPH. For diagnosis, you can order PSA level, prostate specific antigen. It's gonna be up because this is prostate issue. Anytime person has prostate issue going on, their PSA level, it's gonna be up. BPH, PSA level is high. Prostate cancer, PSA level is high. Prostatitis, PSA level is high. Anytime they have prostate issues, PSA level, it's gonna be high. So choice of treatment for BPH. Choice of treatment is Hydrin, okay? Alpha adrenergic antagonist. Alpha adrenergic antagonist, that is Hydrin. So Hydrin is actually treating two things. One is BPH and second is high blood pressure. If somebody has high blood pressure and BPH, we give them Hydrin. If they only have BPH and no high blood pressure, then we give them Flomax. Flomax, that means maximizing the flow of urine. That is Flomax. It's used for BPH only. If they have high blood pressure and BPH, we use Hydrin. Hydrin is also known as Terazosin. Okay. If they would like to try something herbal for BPH, that is saw palmetto. That is herbal medication for BPH. Now, next one is acute prostatitis. So for acute prostatitis, what is happening here? They have this bacterial infection, most likely is caused because of the E. coli. They had infection, they had UTI, that urine went up to the prostate, okay, reflex of the urine from urethra into the intraprostatic ducts, okay, and that's how patient gets prostatitis. Number one cause for prostatitis, that is E. coli. So basically it came from the UTI and it went up. Signs and symptoms person can have, they can have low back pain. They have back pain, they have dysuria, urinary retention, pyuria, stuff like that. How do we diagnose patient? Rectal exam. So we do, it's called rectal exam, where prostate is tender. They have pain going on, it's warm and it's boggy. So tender prostate, it's warm and it's boggy, that is acute prostatitis. When somebody has acute prostatitis, we don't vigorously massage their prostate or anything, okay, because it's gonna cause them to have pain, and sometimes patient can get septic because of that as well, okay. So choice of treatment. Choice of treatment is depends on the age of the patient. If it's less than 35, we assume that they probably have STD related infection, and that's why they had prostatitis. It's because of the chlamydia and gonorrhea. So when age is less than 35, we treat or we kill chlamydia and gonorrhea. So we give them ceftriaxone and doxycycline. This is the choice of treatment for PID. Remember, I'm going to help you connect the dots. So PID treatment is very important. PID treatment is rosuvastatin and doxycycline. Okay. PID treatment we're gonna apply here as well for acute prostatitis, rosuvastatin and doxycycline. For acute epididymitis, same choice of treatment. So pay attention here. Acute prostatitis, we are killing chlamydia and gonorrhea. Okay, we are giving them rosuvastatin and doxycycline. For acute epididymitis, same choice of treatment. If age is above 35, then we think that primary source is E. coli. Okay, and we kill E. coli. How do we kill E. coli? Fluoroquinolone, levofloxacin or ciprofloxacin, or we can give them Bactrim. Okay, so depending on the age, we treat the patient. Less than 35, we treat like PID, which is sexual transmitted disease. Age above 35, we treat like UTI. Okay, so fluoroquinolone or we do Bactrim. Next one is chronic prostatitis. Chronic prostatitis, that means they have this infection going on and it's chronically going on more than 6 weeks. But we examine the patient, we do rectal exam. They don't have this boggy and enlarged and warm and tender prostate. Boggy, enlarged and tender prostate is seen for the acute prostatitis. Maybe slightly boggy in the chronic prostatitis. It doesn't hurt when you do rectal exam. If they have chronic prostatitis, their prostate is gonna feel normal. It's non-tender, okay? Maybe slightly boggy, but that's about it. This is chronic prostatitis, most likely is caused because of the E. coli. So we give them Bactrim or fluoroquinolone. Then we have prostate cancer. So prostate cancer, that is the second most common cancer in the male. When we do rectal exam, first of all, this is cancer. Okay, so it's gonna have asymmetrical area. It's gonna be totally different. One side is gonna be different than the other. That is asymmetrical area. They're gonna have hard and fixed nodule, okay, nodular prostate, and it's gonna be painless. That is cancer, prostate cancer. So how do we diagnose patient? First of all, rectal exam. Then we do PSA. PSA level, if it's higher, that means they have prostate issue going on. And then we can also do biopsy as well. Okay. So PSA level gets higher if person is taking Flomax or Proscar. Because how does this medication is working? Flomax and Proscar is gonna shrink down their prostate, okay? And that's why, because it's shrinking down, PSA level is gonna go higher. Okay, so Flomax and Proscar, it's gonna shrink down the prostate, and that's why their PSA level is higher. How does the Proscar works? It shrinks down the prostate by 50%. Okay, so that's why their PSA level automatically goes high. Then we have testicular cancer. Testicular cancer. So person who has at birth, okay, they have undescended testicles. That person is high risk for testicular cancer. Undescended testicle, that's called cryptorchidism. Okay, cryptorchidism, that is undescended testicles, person is high risk for cancer, testicular cancer. So when somebody has testicular cancer, okay, what type of signs and symptoms they have? When we examine the patient, we feel that there is a fixed nodule, there is asymmetrical area fine in comparison to the other testicle. Asymmetrical area, they have this nodule that is hard and it's fixed. Most common age for the testicular cancer is 20 to 35 years. So how do we diagnose the patient? ultrasound. If we see that this is nodule, okay, we order ultrasound. And also after the ultrasound, testicular biopsy, that is the gold standard. And at the end, we refer patient to urologist. Then we have torsion of the appendix testes. It's not a big deal. We don't even know why this appendix testes is there. Is there any function? Is it helping? Who knows? Okay, it's there for no reason. So this appendix testes, it mimics the signs and symptoms of testicular torsion. That's why everybody freaks out. Okay, so physical exam, it reveals that they have blue dot sign. That means, as you can see, this appendages of the testicle, it's twisted. Okay, when it gets twisted, they have no blood supply, necrotic area, and that's why they have blue dot sign. Okay, that particular area, it's gonna be painful, tender. They have blue dot sign. That is classic for appendix testes. So what do? Definitely we get the ultrasound done and we refer patient to the ER. Then we have priapism. So what is priapism? Prolonged and painful erection for more than 4 hours. Prolonged and painful erection for more than 4 hours, that is priapism. There are patients who are high risk for this condition. First of all, if they have sickle cell disease, okay, they are going through sickle cell crisis, they can have priapism. If they are taking drugs for erectile dysfunction, they can have priapism. If they are snuffing on cocaine, they can have priapism. If person is quadriplegic, they can have priapism as well. So this is painful and prolonged erection for more than 4 hours. This is surgical emergency. We refer patient to the ER. Then we have testicular torsion. So this is medical emergency, testicular torsion. As you can see in this picture, the testicle is twisted around, okay? When testicle is twisting around, they're not getting the blood supply. That's the big deal. Abrupt onset, all of a sudden they're having this excruciating pain. The area is swollen, it's red, it's tender, okay? Normally when we tap on the thigh, the testicle is supposed to go up. That's the normal findings. That's called crematory reflex present. That is good. When we tap on the thigh, testicle goes up. That's perfect. That's called crematory reflex present. But think about this. This testicle, that spermatic cord is twisted. Okay, that's why this whole testicle is twisted as well. So when you tap on the thigh, do you think this testicle gonna go up? No, because there is a twist. Okay, so this testicle is not gonna go up. That's called loss of crematory reflex, or crematory reflex is absent, and that's not good. There is another sign, it's called French sign. Basically, when you lift up the testicle, pain goes away. In this case, when you lift up the testicle, pain doesn't go away. That means French sign is negative. Crematory reflex, negative. So that's not good at all. Okay, that is testicular torsion. We have smaller window here. Okay, if we wanted to save the testicle, we have to refer this patient urgently to the ER. Urgent urology consult is required. Okay, urgent ultrasound is required as well to check for the blood flow. Okay, if there is cut off blood flow, that means this testicle is gonna get necrosis anytime soon. So that's why this surgery is urgent. Okay, so we have the 6-hour window period for survival from the onset of symptoms to the 6 hours. In that time period, we have to get the ultrasound done. Person needs to see urologist and patient needs to take him for the surgery. If this condition lasts long for 24 hours, that testicle needs to be removed because it's already dead. Okay. Next one, we have acute bacterial epididymitis. Epididymitis also infection. So bacterial infection, we give them antibiotic. Person who has epididymitis, what kind of signs and symptoms they have? Affected area, they have pain, unilateral scrotal pain, erythematous area. They have scrotum that is swelling up. When somebody has this fullness in their testicle, okay, it's tender, it's swollen, it's red, erythematous, all this signs and symptoms going on. They also have low-grade fever as well. When you lift up their testicle, they feel relieved in pain. So relief of the pain with testicular elevation, that's called French sign positive. And that is classic with acute bacterial epididymitis. So here, when you tap on the thigh, the testicle is gonna go up, right? So that's called positive cremasteric reflex. So epididymitis, they're gonna have French sign positive, cremasteric reflex positive. That is classic for epididymitis. So what is the choice of treatment? Same choice of treatment that we did for acute prostatitis, okay? Age less than 35, we treat like STD or PID, rocephin and doxycycline. Age above 35, we are killing E. coli, we are treating UTI, basically. So choice of treatment is fluoroquinolone or Bactrim. Then we have erectile dysfunction. Erectile dysfunction. So which patient can have or they are high risk for erectile dysfunction? If they have uncontrolled high blood pressure, uncontrolled diabetes, if they have vascular insufficiency, that means they have diabetes, high blood pressure, all this. If they are smoking, if they have low testosterone level, those are the patients at high risk for erectile dysfunction. If they are smoking, if they are also drinking alcohol, they are high risk as well. Erectile dysfunction, that means inability to have an erection firm enough to perform the sexual activity or intercourse. So that is erectile dysfunction. So we have choice of treatment as well. Either they can take Viagra, Cialis, or Levitra. Those are phosphodiesterase 5 inhibitors. So those inhibitors, how does that work? Dilates everything, okay? Dilates their blood vessels. And that's why we advise patients not to take nitrate with those PDE5 inhibitors. Because nitrates, what is the job for the nitrate? When do we prescribe nitrates? When person has high blood pressure, we can give them nitrate sometimes. When person has coronary artery disease, they have stents, they have bypass, we give them nitrates. Nitrate helps open up their arteries. It dilates the arteries. So when person takes 2 medications that can dilate their arteries, what can happen? They can have sudden onset of hypotension. All of a sudden, blood pressure goes down. Blood pressure goes down, heart doesn't get blood supply, and person can have MI, heart attack. That's why they cannot take Viagra or isosorbide both together. Cannot take Levitra or Cialis or nitroglycerin together, okay? If they have to have it, they can take 24 hours apart, but they cannot take it on the same day. For the exam purpose, it's contraindicated. So Viagra, Cialis, Levitra, they can use for erectile dysfunction. Those are PDE5 inhibitors. So There are some requirements when to take this medication. Viagra can be taken empty stomach 60 minutes prior to sex. Cialis within 36 hours of the sex. Levitra, same thing, 60 minutes before sexual activity. Then we have Peyronie's disease. So what is Peyronie's disease? There is a fibrous plaque, okay? It's built up on top of the penis. This fibrous plaque, it doesn't bother them. It only bothers them when patient has erection, okay? When they have erection, because of the fibrous plaque, they're gonna have pain. So they have primarily penile pain during the erection. And it's because of the Peyronie's disease. What is the choice of treatment? We refer patient to urologist. Then we have Balanitis. What is Balanitis? This is the candida infection, candidial infection, fungal infection. Which person is affected? If they have diabetes, they tend to get more fungal infection. Uncircumcised man, they tend to have more Balanitis, fungal infection. Immunocompromised patient. So diabetes, uncircumcised man, and immunocompromised male patient, high risk. Okay. Choice of treatment, antifungal, topical. Then we have varicocele. So what is varicocele? Those are abnormally dilated spermatic veins, okay? So it's dilated and it's become tortuous, it's wiggly, okay? It's look like bag of worms. What kind of sign and symptom patient can have? They have scrotal pain, recurrence of scrotal pain. So what is the diagnostic test? Ultrasound. Then we have phimosis. So what is phimosis? Phimosis, that is inability to retract the foreskin. So foreskin, it's over the glans penis, okay, and it stays there. It doesn't come back to its place. So inability to retract the foreskin, that is phimosis. Choice of treatment is periodically gentle retraction. And sometimes topical steroid, it can help as well. Person can have paraphimosis, that is more dangerous than phimosis. Paraphimosis, they have the skin that has come all the way to the glans penis. It doesn't come over the glans penis, it's just halfway there, okay? And there it creates the round ring because of the skin. It just went inside and it creates the ring. That ring, it causes the pressure on the glans penis, and that's why it becomes necrotic. Bluish discolored area on top of the glans penis because of the paraphimosis. That is urologic emergency. Inability to reduce the foreskin back to the anatomical position, and it's causing patient to have bluish discoloration. So that is urology emergency. That is called paraphimosis. Then we have hydrocele. In the scrotal cavity, hydro means water, means fluid, collection of the fluid. It's surrounding the testicle. So how do we diagnose the patient? So when there is a fluid, okay, we do, it's called trans-illumination test. That means we shine the light. When we shine the light and it's glowing, okay, there is a glow, that means there is a fluid inside. If there is mass or big lesions, okay, it's not gonna glow because it's not a fluid. but this is fluid. So when we do trans elimination test, we shine the light, it's gonna glow. So that's number one test. Second test is scrotal ultrasound. In the ultrasound, if they have hydrocele, it's gonna catch. And at the end, we refer patient to urologist. All right, and that's about it.